So we're going to get started because it is 1 o'clock, and that's what we posted. This is a public hearing to present the Area Agency on Aging plan for the next 4 years. I'll go through the plan, answer your questions, but if you have a public comment that you want to make about the plan, I will ask for you to come up here and speak in the mic because we are recording this. Give your name and your comments. So we'll go from there, okay? I'm Mary Beals-Lutka. I'm the Area Agency on Aging Director, and the Area Agency on Aging is part of NACOG, which is Northern Arizona Council of Governments. Gail Golden and Susie Underwood are here, and they're both on my advisory council on aging, so we appreciate them being here. One of their jobs is to bring in public input from their counties and bring it to us so we can get out there and figure out what everybody else needs. So the Area Agency on Aging, again, this is a draft. There's 3 purposes for this. It's our planning document. So this is what we plan on for the next 4 years. It's a formal commitment to the State Unit on Aging. The State Unit on Aging is housed with Department of Economic Security, and every state has a State Unit on Aging. And it's really viewed as our blueprint for action. This is a description of who we are. We are a separate unit within NACOG. But one thing some folks don't know is that we are a nonprofit. We are a 501(c) nonprofit agency. We are designated as the Service and Planning Agency for Aging by the federal and state governments. There are 622 area agencies on aging in the United States at this time. We now currently have over 50 contracts and memorandums of understanding with local governments and local providers. One thing we often get questions about is how do we allocate our dollars? What is that based on? It's based on several things. First of all, we use a state funding formula. The state funding formula is based on demographics of those who are 60 and over, also those who are of minority or poverty. So there's a point system. So if I have someone who's over 60 living in one of my counties, they're not a minority and they're not in poverty, they're 1 point. And it goes up from there. So it is a weighted formula. We be sure and check every year our current demographics. Where are the demographics shifting? Are we making sure that we're providing parity? We also look at the results of our needs assessment, which we just finished. The needs assessment was done in collaboration with several departments at NACOG. So we did a community assessment this time rather than just an Area Agency on Aging assessment. We got 650 responses by survey, plus we did 4 community forums, one of which we were unable to do, so we did 4 instead of 5. So we look at the results of that needs assessment, and we are going to review that a little bit later on here. We also look at the wait lists. The wait lists are really important for us to know when people are waiting for services. If the care coordinator goes out and assesses someone and they're eligible, but we don't have any funds or a provider, then they go on a formal wait list. So our wait lists are also looked at. Our highest wait list per capita is in Navajo County. We also look at the availability of service providers. Are there providers in the area? You know, is the infrastructure there that we can utilize? And here comes the needs assessment. Again, it was a little bit different process this time. So all I'm going to do now is hit the top 5 things and what we're going to take action on. But you can go online, and if you're still having trouble going online, afterwards we'll have you touch base with Bob Simmons, because somebody tried to go on through Mozilla or Firefox, and they couldn't get in. They said it was unsecured and something was wrong with the website. So we'll look at that to make sure that you can get in there. So you can look at all the raw data from the needs assessment and look at number 6, 7, 8, 9, 10 as far as the needs go. Well, guess what? No surprise here. The number 1 unmet need is transportation. This is not my first plan, and every time I've done a plan since 2004, transportation has always been the number 1 need. So what are we going to do about it? We're going to continue to work with mobility management. We started mobility management in the Area Agency on Aging, and it now is part of the planning department at NACOG through ADOT. And we're continually working with them. We're going to up our outreach this year. We're going to actually do an outreach plan for the whole agency. and utilize our toll-free number. We do have a toll-free number that you can call, 877-521-3500. And our transportation team provides the intake team with a matrix of all the transportation that they've cataloged throughout our region. So good place to call if you need any kind of information about aging or long-term supports and services in transportation is to call our toll-free number. The next unmet need, food, nutrition. Are you aware that Arizona is number 15 from the bottom in food insecurity and malnutrition? And that's not a good place to be. So food and nutrition is definitely a focus. And it's not just food and nutrition, it's malnutrition. You know, you can maybe getting food in a food box, but if it's not the right kind of food, you can still be malnourished. So that definitely, we are going to improve our delivery system. Right now, we're in the middle of a request for proposals. And one of the things we asked for in there was, you know, to look at their systems, you know, and make sure we have the best comprehensive system we can possibly have for our clients so that we can get good food out there and good nutrition. And also quality assurance, making sure that the providers we do choose to move forward with have a quality assurance mechanism in place. And, you know, for all of these, I could put money on every one, you know, always funding, funding, funding. This next one I did put increased funding. Unmet need is senior aging services in general was the number 3. So our action is I will be increasing my advocacy for funding, doing increased outreach for awareness of what's available and how we're funded, and also developing new funding streams, working with private pay and doing some other kind of initiatives that aren't government funding because we have to. Unfortunately, our demographics keep going up and our funding is either flat or cut. And so these are tough times right now. And you'd think, oh, aging, look how many aging folks we have. Well, somehow it's not translating to the government. And so everybody, we need to rally around and advocate for the seniors that are in need. The next one was healthcare in general. Again, outreach for more knowledge about services that are available. Sometimes there's services available and people don't know about them. So how can we get that toll-free number out? That's the best place to call. Our INR staff can help you hook up with whatever's available in your community. We're going to do more collaboration with transportation. One of the biggest barriers to healthcare service is transportation. What if you don't have a way to go to Show Low to the doctor and that's where your doctor is? How do we mitigate that? How do we work with that? And increasing our partnerships with healthcare providers is critical. And we're continually working on and making strides in the combination of medical and social. And we're the social and the hospitals are the medical. And how do we work together to be more efficient and also help with medical costs? Because everything doesn't have to be medical. There's a lot of things we can do. And also looking at your social determinants of health, we can help with that social piece and cut down costs. And number 5, this was a new one, prescription drugs. It's really a problem getting a handle on prescriptions. Sometimes I have seniors picking between food and pills, or they cut their pills in half when they really shouldn't. And so that's an issue. So really our action is to increase that Medicare benefits program that we do. We're going to be increasing our volunteers. If anybody's interested in being a volunteer, call our toll-free number. We would love to train you. And the coordinator for the Medicare program actually is in Lakeside on Wagon Wheel Plaza, so she's out in Navajo, Apache County, and very accessible. So we do need more volunteers. We're going to increase our client contacts and do more outreach on the program because it's not just about Medicare. It's about signing up for low-income subsidies. It's about knowing that those subsidies are there, and it's about picking the right plan for your Medicare Part D and understanding what that is. We aren't going to sell you anything. It's not what we're there for. We're there to give you unbiased information so you can make an informed decision for yourself. But oftentimes you don't have all the information in front of you. And, you know, our Medicare program can really help you with that. In the last, well, from July 1 till the end of February, we saved $600,000 for our clients from the Medicare program, put that money back in the pockets of seniors. That's huge. So utilize that program and we'll continue to grow it. One of the biggest parts of the plan is our goals and objectives. So I just want to outline first that the goals were chosen by the state 10 years ago. So we're not allowed to change the goals. What we do is change the objectives. Once this plan is accepted and gone through regional council, then we do the action plans. Every year, my staff does action plans for each one of these objectives. And that's when we get in the nitty-gritty. This is what we're going to accomplish by. There have to be timelines. And then every year, in January, we report on the plan to the advisory council. And also, at the end of the year, we let them know, because that's one of their roles as well, is kind of what kind of progress are we making on the plan. And then each year, we send a new action plan to the state. And then we report to the state, what did we accomplish this year? First is general administration. The goal is to increase the ability of older adults to remain active, healthy, and living independently. Our objectives are to maintain integrity of fiscal and client-supported data. That has been an issue this last 4 years with the state system. It is getting better, but we have done some parallel systems out of necessity to make it better so we don't lose data, and we make sure until the state system is fully functioning that we have a handle on the data that we need for us. So we do have that, and we're continually working on that. And also to improve our tracking and delivery system for providing services in Region 3. And we've been working on that. Marketing, advocacy, and education, really to increase that awareness of aging issues altogether and preparing Arizona for an aging population. So it's really to inform and advocate on issues that affect the elderly. And then when we get into our action steps, we'll talk about how many presentations we're going to do a year, on what, when, how many news releases we're going to do, how many PSAs we're going to do, that kind of thing. And provide community education on aging issues. So I'm really excited. Tomorrow I'll be able to go to Show Low and provide some education about some aging issues. But we're available for any kind of group that would like to hear us. I've even been at church right after the sermon. They've had me come up and talk, or as soon as church is out, so everyone's there, to talk about aging issues. So we can talk about aging issues from a global perspective, or right from the local perspective, or we can come in and talk about specific programs, or we can talk about just the aging programs that's through the Area Agency on Aging. Nutrition, big, big, big. We really need to provide education and training for our subcontractors. Very, very important. Our subcontractors do have a mandatory meeting twice a year. They come in and we provide training and technical assistance, but we're also available to give technical assistance one-on-one if they need us. We'll come out to the center. And we have a capacity building roadshow, we have a board training roadshow, we have all kinds of things that we're there to help our senior centers develop. We really need to assist our providers in more efficient business practices so they can be competitive in the market, and assure that they're knowledgeable and compliant. That's very, very important. Health and wellness is also a big focus of what we do. If all the baby boomers expect services like our seniors are getting now, they're going to be sadly mistaken, because we won't have the money to serve that many people. So really focusing on taking care of ourselves, taking care of our own health and wellness is really, really important. Taking responsibility for ourselves, and how do we give them tools to do that? One of the tools could be our evidence-based programs that we have. So our objectives are to sustain and expand community outreach services and collaborations with the evidence-based programs. Again, if you would like to be a lay leader in one of those programs, let us know, and we can teach you how to run them. We want to increase the number of evidence-based workshops next year and trainings, and increase the number of adults that go through them. When I say evidence-based, that means they have been gone through a vigorous study, they've gone through beta testing, and they've been published in a journal, and they've been accepted by the government as evidence-based. So we have licenses for matter of balance, chronic disease self-management, diabetes self-management, pain self-management, and we're just getting ready to have our trainer master trained on Tai Chi. So all really great programs to help us stay healthy. So if you're interested in having that in any of your centers or groups, let us know. Here we go. Here's that transportation one. You know, again, continue to facilitate that development and implementation of transportation services. It's tough. One thing I wanted to do last year was vouchers. And really nobody wanted to do it because I have to give them a W-9, because we reimburse the person who's getting the person, and they get a W-9, and people were afraid of doing that. And I know, it's hard. So I'm open to ideas. I have to follow the IRS tax code. You know, when I disperse dollars, we had a whole system in place, and it just wasn't utilized. And so, you know, we're back to the drawing board. We'll think of something else. We've got to figure out a way that we can use volunteers to transport. That's just the bottom line. We got to do that. And we want to provide support and assistance to our provider network and to our community partners. So this is a never-ending story for sure. Emergency preparedness, very important. The coordinators will coordinate with agencies to ensure local emergency responders have current information. In Navajo and Apache and Yavapai County, we work very closely, and we go to the meetings, and we make sure that they have the most updated information about our clients, because when we case manage them, that we have to fill out a paper if they need help for emergency evacuation. So, and the counties are responsible for special needs evacuation, and which is why we coordinate right there. And we've been very involved with all the emergencies that have happened out here. You know, I remember the Rodeo Chetasky fire, and, you know, all the recent ones. You know, we're right there, and our case managers are right out there trying to get everybody evacuated and be safe. So it's a combination effort. Our Advisory Council on Aging, very, very important. As I said, we have 2 members here right now. We have to maintain a balanced, effective council and make sure we have representation from all 4 counties. That's critical. Each county needs to be at that table because you all have unique issues, and we need to have your voice there. Our objective is to continue to provide training to the council on your role and aging issues. And if you have an idea of something you want to hear, you know, we always ask them, do you have an idea for training? We'll try to round that up for you. And also to promote work through the subcommittees, because that's where a lot of the work is done. We only meet 4 times a year, so unless we work in the subcommittees, not a whole lot moves forward. Central intake, I'm very proud of this. I developed this in 2006 because we didn't have it, and that was the #1 thing I heard from y'all is, do we have one place we could call, please? So we do have central intake. It's very efficient staff. They're nationally certified in information referral. So we want to continue to facilitate, maintain that central intake system and to assure quality responsive services. We can log the phone, the telephone calls in. We know how long they're on the phone. We know how long it's taken them to get back to you, to make sure that we're giving you the best customer service possible. Very important. Case management. Over half my staff are care coordinators, and they do the case management for the Area Agency on Aging. They're bachelor's level or above. In the next 2 years, we're going to be certifying them through NQNA, who certifies hospitals. They now have a social services accreditation. So we are going to start that process so that our care coordinators, we know they're top notch, but now we can say they're certified too. So I'm very excited about that. And it'll be a learning experience for all of us. So we have to continue to facilitate that comprehensive system and offer, they offer everybody safety and fall prevention assessments. Oh, they went back, okay. And they do a comprehensive assessment on everybody they go out to see. It's like 17 pages, 18, 17 pages. They look at psychosocial, medical, and financial issues that client might have. So, and when I say a care coordinator goes out, they don't just look at Area Agency on Aging services. They look at everything they can possibly get their hands on, and they go above and beyond, working with the veteran services, working with local community services, anything that we can do to help that client move forward and remain independent in their home as long as they can. Family caregiver. We see nothing but that going up and up and up. In Arizona last year, informal family caregivers. So it would be a caregiver that's not paid, okay? Gave over $6 billion worth of care in Arizona alone last year. So we need to support them because we don't have $6 billion to help. And guess what? 9 times out of 10, the caregiver is the one that becomes sicker because they don't take care of themselves. So we need to take care of the caregivers so they can be good caregivers. So very important to identify them, assess their needs, and find out what they need for education, training, and support. We have support groups scattered throughout the counties, and we also do classes for caregiving. Unfortunately, sometimes you get the job of being a caregiver and you weren't trained for it, and you don't know how to turn somebody in a bed. You don't know how to give somebody a bath in bed. You know, I got it made. I was a nurse, so okay, it just seems like second nature, but it isn't. It's something you need to be trained on, and that's something that we can help with. The Ombudsman Program, this is an advocacy program for any resident living in a licensed home by Department of Health Services. It's really resident-based. That would include foster homes, group homes, assisted living, and nursing homes. So, on the objectives, to educate and empower both long-term care residents and long-term care staff about the program and resident rights. So when he does his action steps, he'll talk about how many he's going to do each year and where, and map that out so we make sure that we're on track moving forward with that. Also, recruitment of ombudsman volunteers. And we're really not looking for numbers. We're looking for quality ombudsman volunteers that really have a resonance with being an advocate and going in and visit these very vulnerable, very frail seniors. They're some of our most frail seniors. And being an advocate for them. And also to facilitate at least one World Elder Abuse Awareness Day event within the region. That is June 15th every year. Around the world is an elder abuse, and last year our program did 3 events. So hopefully we can make that even bigger. I just hooked up the coordinator with a listserv for World Elder Abuse Day that they had a booth at the conference I went to last week, and it was very interesting what they're doing to kind of help coordinate that across our country. So we'll be utilizing some of those things moving forward. Also, just provide public awareness about the Ombudsman Program. So not only will we be training staff and long-term care residents, but the public at large. Years ago, when I was doing the Ombudsman Program, we did a lot of work with the service organizations. Seroptimus, Kiwanis, Lions, anybody who wants to get involved and understand and know what we do so we can get the word out. We're there. We're there to help. The Medicare program, I've already bragged about it a little bit, but here's our goals. Obviously, increase awareness. We want to increase their ability to get Medicare and prescription insurance coverage and give them those options. And also provide training for all Medicare benefits counseling staff and volunteers to ensure they're prepared to assist all inquiries. So our coordinator has developed a new training system called Medicare University, and we're always looking for volunteers for that program as well. It is 60 hours of training, but it's really, really good training, and you can use it in your own life. And we do have several council members that are also Medicare trainers. So if you know anybody who's interested, or if you need help with Medicare or any kind of public benefit, they're also trained to look at SNAP food benefits or Access, All-Tex, whatever might come up. It can be kind of a quagmire, public benefits. It can be very confusing. We're here to help you through that process, so that is a very important program. We have the Senior Community Service and Employment Program, CSEP. That is Title V of the Older Americans Act. And that is to help, again, older adults to remain active and healthy. It's a training program. If you are a public entity or a nonprofit, you could be eligible to be a trainer. You could be a host agency and have a Title V in your agency. And there's certain criteria around that. There's criteria for the Title V participant as well. They have to be 55 plus and of a certain income. So there is an eligibility process. All you got to do is call the toll-free number, and they'll help guide you through that. And we really want to increase our host agencies and increase our number of participants, and also do a better staff development and training in the CSEP program. And we have a deficit of host agencies in Apache County. We have slots, but we need more host agencies. So if anybody knows of any public or nonprofit that might benefit from having a Title V in their facility or their place of business, that'd be great to let us know. So Part 5 is really important in the program, and when you go online and pull this up, you're going to get a lot more detail. These are just the highlights. So we have to provide assurances to the state of Arizona that we do certain things. And one of the things we have to do is we have to ensure that our providers target and serve minority and underserved populations. So that was a question on the RFP. We ask the providers, how are you going to do that? How are you going to serve this population? And then we will be monitoring that. So we'll monitor each provider for fiscal, contractual, and programmatic requirements, and we can go into the state system and review to ensure the specific objectives of the agency are met. So when I see an agency who has 40% Hispanic in their community and they're not serving any at the senior center, I think there's a problem. It doesn't have to be perfect, tit for tat, it's not going to be, but you have to make sure that your programming is welcoming to everyone that lives in your community. And so those are the things that we're asking our providers right now. These are going to be the key changes that we're going to make in our plan moving forward. We are going to do an RFQ before the end of the year for home care. Welcome. So one of the problems that we're having with our home care providers is that we don't have enough caregivers. And the care coordinators are referring and authorizing units, and there's no caregiver to show up, and the units aren't used. And the client doesn't get the service they need. So we're going to be opening it up to a request for qualified providers. So we're going to open up the field a little bit so that we have more providers, and if one provider can't take it, we'll go to the next, and we'll go to the next, and we'll go to the next. So we're in the process of doing that right now. It will be fee for service. There will not be a capitated rate. This is how much you get an hour. If you accept it, that's what you'll get paid. It'll provide more consumer choices, which is really important. It'll provide more caregivers, and we're hoping it creates competition among the providers so that maybe we get a higher quality of care. One of the things they asked us about is, what are we doing to modernize the senior centers? And I think that's a little hard because the Area Agency on Aging doesn't fund senior centers. We fund the meals. So our answer to that is we'll continue to provide those trainings twice a year. And when we provide those, we bring them in. If it's overnight, we pay for their room. We bring them food. I mean, we try to make it as easy as possible for them to come and spend a couple days with us. We're going to help with capacity building and organizational development and ensure communication of the latest trends. And that's one of my jobs, is to come back from Chicago or Washington and talk about, here's what's going on nationally. Here's what we could do here in our rural area. The other thing they asked us is, what are we going to do about self-directed care? Well, we've got our information referral number. We have care plans that the care coordinators do work with the clients to produce. So they engage the client and or the family and or the caregivers as they're doing the care plan, and then the client gets a copy of the care plan as a blueprint for their care moving forward. And they do get choices and be able to put input into that. The care coordinators help clients make informed decisions based on need, and again, our RFQ for the home care. I think that's really critical. This is the website, so we'll double check that with those of you if you want to read it in its entirety. The budget is not complete yet. It will go to council in April, and then that will be posted along with some graphs so you can see where the budget lies within your counties and the allocations based again on those points that I mentioned earlier. And most important, there's our toll-free number. If you have any questions or you forget a staff member's name, all you do is need to call that toll-free number, and those, right now I have all women working in there, so the ladies will help you walk through the maze that can be long-term care and services. So that is the end of my presentation. So if you have any questions, if you could come up here and ask them on the mics, because they are recording this session. Any public comment that you would like to make? Come on. If you would state your name, and then you can make your comment.
Ann Avenenti from Concho, and thank you. Sorry to be so late. Did you give us a figure of how many elderly people are being helped in Apache County?
No, but I can.
Good.
Yes, I can, and in fact, hold on just a minute. Where is my, oh, it's out in the car. That pink case, you want to go get that for me? It has the end of the year report. Just grab that. Okay. So I apologize, I don't have that with me, but we do try to keep those figures. In fact, Gail Golden is an integral part of that, because she always says, can we break it down by county? Can we break it down by county? Can we break it down by county? So we do. I can give you the overall figures, but that's something that we'll post online as well. So you can see Also, when I talked about the Medicare program saving $600,000 for our clients, it'll show you how much in each county. So you can get those numbers. So she's been really good about advocating for that, and I think it's a great request because then you can see what's going on in your county. Yeah, so. Any other questions or comments? All right, I really, really thank you for coming because I think it's important to be involved and see what's happening. Again, this is just, it's meant to be an overarching overview of what we do. Now we'll get into the nitty-gritty and the action plans because those change every year, but this plan will be for 4 years. So I can't change the objectives unless we go through this process again. Good in pink. I like it.
Goes with my blouse.
Yeah, I like it. And this should also be online. We have an end of the year report. This was for last year, fiscal year 2016. And I'm going to look real quick. I have to have my cheaters. I don't think she broke it down in here. Okay. Yeah, I think it's going to have to be on the website. This is an interesting figure, though. We touched 20,914 lives last year in our agency alone. It's a lot of folks, a lot of lives to touch. So and this just gives the overall. So I apologize, I don't have that. But I can get it for you. So if you would make a note, Bob, what I would like to do is to post online how many folks we served in each county last year. And he's the number man. This is Mr. Bob Simmons, our data information specialist. So yeah, exactly, because I can be at a meeting anywhere in the country and I'll email Bob and I need a number on this right now and boom, boom, I got it back. And so that's just so critical. When we're doing advocacy, when we're working on things, is to have those numbers. So he will get that for you. So, and again, I thank you so much for coming today. Really, really appreciate your time. And like I said, in April, hopefully we'll have the budget done. Friday, the RFP goes to Chris with our proposals. So that's where we are on the RFP for meals right now. So everybody have a wonderful day and thank you so much.